Hello. I'm Dr. Diana Fite, President of the Texas Medical Association. Thank you for joining us tonight for TMA's Tele-Town Hall on the COVID-19 pandemic's effect on pressing healthcare issues in the border region. This evening's event will be led by Dr. Luis Urrea, Chair of the Border Health Caucus, and Dr. Linda Villarreal, TMA President-elect. Over the next hour, you will hear from several expert presenters, and we hope the information will be helpful to you and your practice. We welcome your participation in tonight's Tele-Town Hall, so please listen for those opportunities. I'll now turn the evening over to Dr. Urrea. Dr. Urrea?
Thank you, Dr. Fite. We're finishing the process of calling more than 6,000 physicians, medical students, and Alliance members across Texas. This will take us several minutes. Tonight's event is a accumulation of the summer Zoom Along the Border series hosted by the County Medical Societies of Border Health Caucus. Over the next hour, you will hear an update about COVID-19 pandemic in Texas with a discussion on state health care issues. You will hear information about expanding access to care and to telemedicine payment parity. We'll also hear about practice viability issues, including liability protection and cross-border initiatives. Tonight's speakers joining Dr. Villarreal and me are Dr. Diana Fite, Emergency Room Physician and TMA President, the Honorable State Representative Cesar Blanco of District 76, Dr. Luis Benavides, Family Medicine Physician and past Border Health Caucus Chair, Dr. Martha Vela Acosta, Executive Director of the U.S. section of the U.S.-Mexico Border Health Commission, and Dr. Victor Gonzalez, an ophthalmologist and Border Health Vice Chair. We also will answer your questions periodically throughout this call, so stay tuned for instructions on how we can ask them. And we want your answers to poll questions. We will tell you how to reply to those when the time comes. TMA devoted nearly all our resources for the past 6 months to COVID-19. We want to help you, help your patients and your community as we continue to confront this worldwide pandemic. We understand you face two major threats right now: the very real and ongoing threat this virus poses to your patients, your practice, your staff, your family, and yourself, and the equally real economic threat this pandemic and changing requirements have posed to so many medical practices across Texas. Earlier this year, your TMA Board of Trustees convened a task force of COVID-19. The task force has created FAQs, documents, podcasts, and other guidance to help you and your patients and help you manage your practice. You can find that information at texmed.org/coronavirus. That's texmed.org/coronavirus. I would like now to introduce my fellow moderator to this event, Dr. Linda Villarreal, TMA's President-elect. Dr. Villarreal, welcome. We know these are extremely important issues, and we appreciate all our speakers joining us in this crucial discussion tonight.
Thank you, Dr. Urrea. We knew it was important to convene another TMA Tele-Town Hall meeting to provide more essential information for our fellow doctors, particularly those in our border region of Texas. We hope everyone can benefit by joining us tonight. Since TMA is offering continuing medical education for this event, we will ask a question at the end of this call for CME credit. The Texas Medical Association designates this activity for a maximum of 1 AMA PRA Category 1 credit. Physicians should claim only the credit commensurate with the extent of their participation in the activity. The Texas Medical Association is accredited by the Accreditation Council for continuing medical education to provide continuing medical education for physicians. Physicians who remain on the line for at least 53 minutes will automatically receive CME credit. Dr. Urrea, I know you have information our listeners will want to know as well.
Here's how you can ask our presenters a question or make a comment during this event. At any time, press the 0 key on your phone keypad. A TMA staff member will greet you. Please succinctly tell her your question or comment. Soon we'll call on you to ask your question of our experts. Now it's time to introduce our first speaker, our friend in El Paso, State Representative Cesar Blanco. Representative Blanco, thank you for joining us this evening.
Thank you, Dr. Urrea, and can you all hear me okay?
Yes, sir.
Okay, wonderful. Well, thank you, Doctor, for that wonderful introduction and for your leadership on the Border Health Caucus. I also want to thank Dr. Fite, Dr. Villarreal, and all the members of TMA Got to give a shout out to our doctors out here in El Paso County Medical Society, and finally to my friends, Jake Fuller and Patty Slaughter for coordinating this discussion on the upcoming session and really the important healthcare issues that we're facing. I really also want to thank all of you for the tremendous work that you're doing day in and day out, caring for our border patients as physicians on the front lines, battling COVID-19 in one of the hardest hit regions in the United States. I know the past 6 months have been pretty difficult for us and for all of us, so I want to thank you for all that you're doing on the front lines. We are midway through September, and session is only a few months away. And to say that this interim has been challenging would really be an understatement. As you all know, 2020 has been marked and defined by this pandemic, which has challenged us all in so many different ways. COVID-19 has really exposed the shortcomings in our public health infrastructure and the vulnerabilities in our economy, in our workforce across all sectors and supply chains. The pandemic is also exposing and exacerbating the health disparities among minorities and minority children. The fact is that Black and our brown communities are disproportionately impacted by COVID-19 in terms of health and in terms of economic consequences. This pandemic has resulted in the loss of many lives, sickened many more. It has put thousands out of work. It's devastated businesses, diminished state and local coffers for essential services and programs. It's also kept our kids out of schools and social environments, and will have a lingering mental health impact on all of these stressors. So there are a lot of unknowns when it comes to the upcoming legislative session, but it is clear that we're going to have a very tight budget year. This pandemic has created an economic slowdown in Texas that, coupled with low oil and gas prices, may leave us with a budget crisis ahead of the 87th legislature that's coming up. In July, our comptroller, Glenn Hager, issued a revised revenue estimate for the state, originally projecting a $2.9 billion surplus, and that the pandemic and as well as the drop in oil prices left a comptroller projecting a $4.6 billion deficit by the end of the current 2-year budget cycle in August 2021. And as you all know, leadership has already asked the state agencies to propose a 5% cut to their budgets, and those proposed cuts are already giving lawmakers a lot of heartburn. And this is unfortunately impacting funding for very important items for the future of our healthcare training. As you all know, funding for graduate medical education expansion could be at risk next session with this tight budget. Over the years, we've made significant strides with GME to let up. And beginning in 2013, the 83rd legislature appropriated $14 million to support several efforts to increase the number of first-year residency positions and to establish new residency programs available in the state. The last session, we continued support for GME, appropriating $157 million for the 2020 and 2021 biennium. That's a $143 million increase in 6 years. And you all know that supporting GME ensures that newly minted physicians learn, that they train, and that they remain in the state and the region that provides their medical education. And with our 2 medical schools along our border that our communities fought tooth and nail for, funding for GME is critical for our region, and the doctors being trained at both here in El Paso at Texas Tech University Health Science Center and also at UTRGV, it's so important. When you have agencies, proposing cuts to children's therapy services, women's health care services, or cuts to food banks, right in the middle of a pandemic, lawmakers are already asking these agencies to go back to the drawing board. And we're in a really difficult situation. Now, this next session, there's a potential for the House to flip, and Democrats, if they gain the majority in the House, we've been having a lot of conversations in the caucus about budget priorities, and I think that you're going to see some changes. It might be difficult to reconcile with a Democratic-controlled House and a Republican-controlled Senate. We've seen that type of gridlock in Washington, D.C., where they can't agree on COVID-19 aid or recovery packages. And I know that Texans, including me, including you all, we don't want to see Texas to become a Washington, right? So we need to come up to the table and figure things out and start with things that we agree with. Prior to the meeting of the legislature in January, the comptroller is going to give an estimate on the revenue for the 2022 and 23 biennium. One thing working in Texas' favor is its rainy day fund, which is expected to end the current fiscal year with an $8.8 billion balance. And quite frankly, the rainy day fund was designed for purposes just like this. And I'm going to be in favor, and many of our colleagues along the border are going to be in favor for using these funds before cutting the essential services and programs that Texans rely on. We shouldn't leave this money on the table, and the balance, and to balance the budget on the backs of Texas when they're hit by this pandemic the hardest is not a good thing to do. So we want to make sure that we're utilizing these funds. We hope that we're able to expand Medicaid. Accepting Medicaid expansion alone would return Texas tax dollars to our state to the tune of $10 billion per year. Texas is first in the nation in people without health care insurance. And that number was 18% before COVID-19 pandemic, and now it's about 29%. And as you all know, this caucus knows, it's even worse along the border. So, expanding Medicaid would improve all Texans' access to care and is essential for fighting against COVID-19. Here in El Paso, I'll give you a quick number, 47,000 people would have access to care under Medicaid expansion. So, with Texas' high rates of uninsured, especially with COVID, it's unsustainable, especially uncompensated care costs for physicians, community clinics, and hospitals. And in this era of COVID-19, physicians, hospitals, providers are also having trouble absorbing more uninsured patients as they struggle to stay afloat themselves. You all are dealing with this. So in terms of healthcare priorities for the legislature, I'm going to put Medicaid expansion at the very top. I think is a very important thing. The case for Medicaid expansion can't be any clearer than it is now. And if Democrats do win the House, I'm hopeful and optimistic that we can get it done. This pandemic is also changing the way that you all see patients. With today's technology and need to social distance, I think telemedicine has been a vital tool on the continued delivery for care. My mom just recently used telemedicine with her physician here in El Paso. We also know that telemedicine can also help close an access gap in rural and border communities. And in the beginning of the pandemic, Governor Abbott, as you all know, suspended and waived certain rules related to telemedicine, in which under the waivers and suspensions, you all are eligible for payment and insurance plans from insurance plans regulated by TDI for medical visits that are conducted over the phone instead of in person at the same rate they would receive for in-person visits. The governor also issued waivers for portions in the occupation codes that expand provider flexibility in providing medical services over phone. As the state continues to respond to COVID-19 and maintain regular healthcare services and operations throughout the state, telemedicine is one of those most valuable tools that we have to ensure that Texans continue to receive the health care services they need. So, next session, I think the legislature is going to be looking at expanding telemedicine options. And if these waivers and suspensions are improving access to care, I think that the legislature should consider permanently suspending and waiving these rules so doctors are adequately compensated for telemedicine visits. COVID-19 is also not restricted by borders, as you all know, and as all our communities along the border can attest to. Crossing the border is part of life in our communities, and because of that, infections follow that traffic. And as a lawmaker and as a resident of a border community, I believe that we have lacked a true cross-border strategy to mitigate the spread of COVID-19, coordinating testing and tracing efforts and share live information. But it's not surprising when nationally we have never had a true testing and tracing strategy that stems from a lack of leadership at the national level with someone who's more concerned about polls than health and science. At the state level, we're holding meetings with local public health officials, stakeholders, and the relevant state agencies to discuss what we as a state can do to better coordinate with our Mexican counterparts if our federal government is not. We're going to have to do this ourselves. So, these are just some of the healthcare priorities that we're going to be looking at next session, among many of the hot-button issues that are facing our state and our people. As we continue to plan for next session, know that my office is always has an open door, and that we're always willing to listen to your issues and to be educated by you on these issues. So I encourage you all to reach out to me and to all of our border legislators to keep this conversation going, because we're really going to need your guidance on how to approach these difficult issues during the next legislative session. So, Dr. Urrea, I want to thank you so much for the invitation and your team. I want to continue to have close collaboration with you, and I can't wait till you and I can go down and have some more Mexican breakfast, which is probably not very healthy, but it's good for the soul. So thank you, Doctor. Appreciate it, and thank you all.
Well, thank you, Representative Blanco, for giving us such a comprehensive outline on what to expect in our next legislative session. We'll have to be more active in our advocacy on behalf of the border and our patients, and thank you for being such a great friend of the Border Health Caucus and TMA. Now it's time for our first poll. Yes, sir. Thank you. Now it's time for our first poll question of the evening. Here's the first question we want everybody to answer using your phone keypad. What issue is most important to the viability of your practice? Press 1 on your phone keypad if your answer is Medicaid physician payments. 2 if your answer is Medicaid coverage expansion. 3 if your answer is MCO administrative simplification and reform. 4 if your answer is telemedicine and payment parity. Or 5 if your answer is liability protection. Once again, what issue is most important to the viability of your practice? 1, press 1 if your answer is Medicaid physician payments. 2 if your answer is Medicaid coverage expansion. 3 if your answer is MCO administrative simplification and reform. 4 if your answer is telemedicine and payment parity. Or 5 if it's liability protection. We will tabulate and report the results soon. Linda?
I'd now like to introduce our second speaker of the evening, who is TMA President, Dr. Diana Fite. Dr. Fite will share her thoughts on possibilities for expanding access to health care to all Texans who need it. Dr. Fite, welcome.
Thank you. Well, as Representative Blanco was saying, he thinks the priority is expanding Medicaid. TMA has had the policy of favoring Medicaid expansion from the beginning, but we know the governor and lieutenant governor have been opposed to expansion. Their thoughts were that even if now the federal government paid more toward Medicaid funding, which would be 90%, that percentage would decrease over time, increasing the amount that Texas would need to pay, and would put so many more people on the roll that it would be a problem, and the money just needing to be more and more coming from Texas. However, now we're getting more and more uninsured. As Representative Blanco mentioned, the statewide amount is about 18.4%, but sounds like on the border is more along the lines of 29%. So with this pandemic, it's going to be even worse percentages, because that 18.4% was calculated before the pandemic. So the way that the Medicaid works right now, which y'all probably know, but it is funded from federal, state, and local funds, and the federal amount is out of every $100 spent on the program, $60 is from the federal government. But as we also know, the Medicaid will only cover children, pregnant women, disabled adults, and the elderly, but will not cover non-disabled males or females unless they are pregnant. So that's a huge number of people that cannot have any insurance. And our eligibility rate is so low, it's the second lowest in the nation, it's essentially poverty level, that even the people who would qualify, such as disabled adults, if they had a part-time job, they would no longer qualify. So at this point, we just have to have expansion, and the TMA has written a letter to the governor, signed by both me as president, but by 33 other specialty societies and similar groups, asking that he please now at this point with COVID making things even worse, consider some sort of expansion. Expansion would allow the federal government to pay 90% and would also begin to cover non-disabled adults and up to 138% of poverty level, which we estimate would cover probably 1 million or more people in all of Texas. So a large number of people, obviously, on the border. Now, how can we convince this to be done? And we have talked to the governor and lieutenant governor about that consideration, and they seem open to at least listening to options. Well, there's been a calculation was actually made in 2013 where it was suggested that actually the savings that would accumulate from all these reasons I'm going to give you in just a moment would end up making money for Texas instead of causing us to lose money. And let me explain that, because we need to be able to talk to our legislators about this. So some of the things that would actually save us money would offset the cost of us paying 10% toward it, but insuring more people, would be, for instance, prisoners are covered by a large amount of money from the state budget, and those prisoners would now be covered by the new Medicaid plan with expansion. That would be a large amount of savings. There's a mental health savings that the state pays for, and that would be now causing those people to be covered under the new Medicaid plan. Substance abuse treatment, a lot of our state budget goes toward that. Well, most of those patients getting treatment for substance abuse would qualify for the expanded Medicaid. HIV medications, people who need HIV medications have a plan through the state that helps to pay for that. Well, most of them would qualify for the expanded Medicaid. And then there's a kidney health care program paid for by the state for people on dialysis who have to be on dialysis for 2 years before they qualify for Medicare, unless they're, of course, 65 or older. Well, it would take care of most of those patients. And there's other ways that savings would occur, not to mention the local tax savings for all the charity care that goes toward the people. So the state could end up saving, we estimate, $110 million per biennial budget to go with this type of expansion of Medicaid. And there's still, the way this has been arranged, Texas would have input on how the funds are spent. And we need to get our governor, our lieutenant governor, and our legislators convinced that there is a way to handle some expansion of Medicaid to help us out. So that's what the TMA is going to fight for. Thank you.
Thank you, Dr. Fite. We can all agree that expanding Medicaid in Texas is not only best for our patients, but also makes for good business sense for the state, as you explained to us. Now I'd like to share the results of our first poll question. We asked, what issues are most important to your practice? 32% stated telemedicine and payment parity was most important, followed by 28% in Medicaid physician payments, 18% for Medicaid coverage expansion, 17% for liability protection, and 5% for managed care organization administrative simplification and reform. So certainly everybody feels that there's a lot of need for all these different issues that we need to help us with our practice and the care of our patients. I would like to welcome back our next speaker and my co-moderator, Dr. Linda Villarreal, who will discuss the importance of achieving payment parity for telemedicine.
Thank you, Louis. I appreciate the opportunity to just take a few minutes of an amazing panel of speakers, including me, of course, to discuss some of the most important issues that are affecting medicine in this day and age, this day being today and since March, and this age where we are all struggling to maintain our private practices. So my topic in theory was telemedicine. Well, over the last 4 to 5 weeks, as the Border Health Caucus County Medical Societies met on a weekly basis, each one taking turns, I've got to congratulate all those present that were involved with that. And hopefully a lot of our speakers tonight participated in those individual county medical society Zoom meetings. They were absolutely amazingly interactive and informative, and it gave us a real good picture of what the border health problems are, much more intense than anywhere in the state of Texas, even though all the state of Texas has some issues. But during COVID, of course, there was a multiplicity of problems that kept patients from coming to their doctors. And let me just tell you that telemedicine, and this has been said many times before, telemedicine has advanced from March of 2020 to now, what it would probably would have taken 10 years. So in the last 6 months, we have advanced the utilization, the comprehension, and the participation of telemedicine with our patients, what it would have taken a much longer period of time. And every day that I use it, and I use it every day, I can actually relate to the patient who almost feels amazingly inspired by the fact that she is a little old lady, is able to accomplish a technological task and be able to communicate with her doctor. Many patients have stayed away from their patients because they're fearful of exposure. But that's not really what I want to communicate to the audience. What we need to really zero in on now that a lot of our patients and a lot of our colleagues in the practice of medicine are doing very well utilizing telemedicine. But I want to talk to the audience tonight about telemedicine parity. And what that means is obviously getting paid for a face-to-face visit, whether that's in the patient's office, in the patient room in your office, whether it's on the FaceTime on your phone or their phone, whether it's on iPads, grandpads, telemedicine programs that we are utilizing, that is still a face-to-face visit. And there is absolutely no reason why we as physicians should not get paid equally as if they were in our office. Now, during the pandemic, of course, the governor gave a waiver and made sure that we were going to get paid parity to face-to-face as if they were in our office. But this statute is probably expired by now. It hasn't been addressed, but it could potentially be addressed. So we need to make sure that we advocate for this through our legislators to the state leaders, the governor and the lieutenant governor. Now, of course, a lot of this telemedicine parity payment is dealt through the federal government, especially when it's dealing with Medicare. But as you know, like so many, most of these payments are done through a third party, and that is localized in the state as well. So hopefully they will look the other way and continue to pay us and give us payment parity as if we were actually seeing the patient in our office. Now, how do we make this something that continues, though? If, God willing, we are able to get a vaccine and the COVID pandemic continues to slow down, as it is doing in many areas of the state, what will happen then? Well, now we have trained our patients and we have trained our physicians to utilize an additional tool, that being called telemedicine, because so many patients will not come, and for many reasons. No transportation, fearful of leaving her home for whatever the reason. There are many reasons right now without the pandemic that patients would not go to the doctor's office. Now we have actually initiated, enhanced, and really successfully started using telemedicine, and now we need to make sure that we keep that payment parity. So my ask to our colleagues in the audience and your colleagues who couldn't listen is to advocate and legislate through your legislators programs, bills to introduce to at least one, have the governor continue the waiver to get parity on payment, but now also advocate with our congressional members from our state, and a lot of us have relationships with our congressmen. A lot of us know who our congressman is, but keep in mind there are areas in other parts of the state of Texas that we are not familiar with. So you also need to share this task with your colleagues who may be out of Dallas or out of Amarillo or out of, Beaumont. We need to send the message to Congress that what they have approved and started through a temporary waiver needs to continue permanently. In the end of the day, we can always do telemedicine with our patients, and that avoids emergency room visits or uncontrolled diabetes or elevated blood pressure. We have asked our patients to learn this method of communication and, quote, office visits, and they have stepped up to the plate and have partnered with us to be able to keep them healthy. But at the same time, we need to make sure that we get paid the same amount. So right now, the grassroots, beginning with the Border Health Caucus, the grassroots need to do the lobbying with our local legislators, send emails, talk to their health advisory personnel in their office, go to D.C. if someone asks you to go with them, participate in the lobbying effort to let our congressmen know that telemedicine payment parity is something that will actually, just like the previous speaker mentioned, will actually save the state money by us allowing physicians to stay in contact with our patients. One last thing I'd like to comment is one of the negative comments from people are saying that we shouldn't get paid because we don't have as much overhead. So I told that individual, I said, let me send him the bill. The overhead is the same, if not more, simply because time is costing us money. So if anyone says that to you, count the number of hours required on the telemedicine preparation for contacting the patient, the computers, the IT input, the multiple technology tools that we are having to use, and it actually is costing us more. And also keep in mind that parity involves an increase in payment overall with the federal and state programs, which have not improved in the last 20 years. And may I say, even before I was going to talk about this or knew the answers in your first poll question, I can see that 32% of the answers did involve telemedicine and payment parity. So this is going to be my new mantra over the next 6 months to make sure that we are getting paid, and if the waiver is not continued, that we advocate through our legislators and our congressmen to do something about it. We do have friends in the State House, and we do have friends up in Congress in Washington, D.C., that understand our plight. We simply need to give them that grassroots support. If anyone has any questions about this, please don't hesitate to call me. I do appreciate the results of that first polling question. It just does appear, it appears that we're all dealing with the same problems. If we can actually get payment parity, we can actually improve physician payments, we can cover Medicaid coverage, we are actually going to be a healthier community that travels from Brownsville all the way to El Paso along the border. Thank you all very much for listening.
Thank you, Dr. Villarreal. Telemedicine certainly is a very valuable tool for providing health care and increasing access. So it is appropriate health plans pay for those visits at the same rate as in-person visits to help us take care of patients and decrease ER visits and improve the care of Texans. We're running a little behind time, so I want to remind everybody to please press 0 on your keypad and tell the TMA staff member your questions. And we'll get to your question, but we're going to wait for the next session. I want to progress with our speakers. So press 0 and please briefly tell your question. So now I'd like to introduce our next speaker, Dr. Luis Benavides, who will discuss practice viability issues, including liability protections for providing care in the time of COVID. Dr. Benavides, thank you very much for joining us and for your leadership in the Border Health Caucus.
Thank you for allowing me to speak. I just want to touch on a few topics that are obviously of concern to all of us. The issue of practice viability. I want to echo what Dr. Benavides said about telemedicine. Very important we get parity. And yes, it is just as time-consuming as an in-office visit. And I want to thank Representative Blanco for appreciating that and that it is. So we need to, TMA will continue to advocate for that telemedicine parity to keep our practices going, as well as Medicaid expansion, which is very important to us along the border because people are losing their jobs, and a lot of people are not having the appropriate finances to pay for their medical care. On the other hand, we also have other areas that we can look at. If those of you on the call have not downloaded the TMA COVID-19 Practice Viability Toolkit, I invite you to do so. A lot of valuable resources there. We've had the Payment Protection Program, which they gave us advance notice of when that came, and even now we have access to, and it pretty clearly explains about economic injury disaster loan advances there, where we can keep our practice viable and keep our practice going in these difficult times. Express loans as well when things are a little bit more rapid. All these are excellently summarized in the Practice Viability Toolkit. In addition, we look to other sources. Our insurance partner, Texas Medical Liability Trust, gave out an unprecedented $13 million in dividends right at the onset to help us all, especially those that were gearing up for telemedicine and that big advance that occurred. They also provided some PPE, and of course TMA did a phenomenal job in providing the PPE that we need and continue to do so. I'm sure that at times that will run out, but in the meantime, hopefully they'll give us, make us into groups and partner us with suppliers that will give us reasonable rates. But all those kinds of things to help us continue to see patients, which is really what we need to do, allow us to have access to care in a safe way. All of us preparing for that second wave that will probably come with the school reopenings, with the hardships that are created. especially along the border, people losing their jobs. We have a lot along the border of multi-generational households, and this is only going to increase as time goes on with this situation. And so the risk of transmission in those multi-generational households is also going to contribute to the second waves. So we also want to focus on some liability protections, not only medical liability protections, but protections for us as employers. We want to be sure that reinforcing prudent layperson standards. We know how infectious this disease can be, and some of our staff may get it, but as long as we use these prudent standards, we should not be held to a higher liability. So we need to continue protecting our practices and protecting each other, and the Border Health Caucus is strongly behind that, and TMA is as well.
Thank you, Dr. Benavides, for sharing that important information with our physicians. I would now like to introduce our next speaker, Dr. Marta Vela Acosta, who is Executive Director of the U.S. Section of the U.S.-Mexico Border Health Commission. Dr. Vela Acosta, thank you for joining us this evening.
Thank you very much, Dr. Villarreal, Dr. Benavides, TMA leadership for this invitation, all of you, and including the U.S. Section Border Health Commission. I will try to go fast, and I would like to say, well, who am I to be talking to all of you? So I'm a former clinician, academic, community advocate, philanthropist, scientist, but like all of you, I want to contribute with my skills into our population's well-being. And I am 8 weeks into this job. So the main point that I want to cover in our time for our border region presently under COVID-19 is the U.S. Section role at the Border Health Commission. Where are we now? What are our next steps? And as a takeaway is the involvement of organizations and the voice of you, TMI. We're very familiar with the statement as previously said here, doctor's orders. And more than 50% of the U.S. Section members are physicians from Texas. Actually, we are fortunate to have, Dr. Benavides and Dr. De La Rosa, champions and community advocates and activists. So about the Border Health Commission, very quickly, many of you already know, in 1994, the public law established the U.S. section of the U.S.-Mexico Border Health Commission. And in 2000, the U.S. and Mexico established the full commission. So we are about 20 years into this. The mission is to provide international leadership to optimize health and quality of life along the U.S.-Mexico border. And I would like you to think of these statements as we are considering COVID. Our goal is to institutionalize domestic focus on border health that can transcend political changes. We want to create an effective venue for a discussion to address the public health issues in all border populations. We want to identify them, we want to support the studies of research, and bring together federal, state, local, public, private resources to form dynamic partnerships that really improve in a multi-sectoral way the wellness for our communities. So this is a binational platform, and here we are half, and our other half is the Mexico counterparts. We want to have a unified voice to raise awareness about what are the unique challenges for the border health populations. We want to create venues and partnerships, and ultimately to have reliable information for all issues, but also to be that voice to the public. Now that's from the letter, but I would like to go into what are we doing now. As many of the wonderful speakers have said, COVID-19 and our global conditions are guiding us to identify exactly what public health policies and healthcare systems have short-term cost but can produce long-term economic performance. Now, economists have been linking wealth and GDP to health and well-being longer than any public health professionals. But all of us experience firsthand with patient care in our communities that the social determinants of health is, as well said, telemedicine, public, access to health care, or unemployment, as Dr. Benavides was saying. So before COVID, even for the U.S., the worst losses for the U.S. in 2011 was $260 billion. That was before COVID. Now, as COVID is peeling off all this, and the value of maintaining a healthy population, the impact on the billions of dollars of each port of entry along the U.S.-Mexico border is really pointing to the complexity of our health disparities, the economic value as a direct outcome of healthcare, prevention, wellness, and our response to public health preparedness. So there are many opportunities that can boost collaboration for public health and economic stakeholders in advance. I would like to touch on three, perhaps two given time that we have, but top industry leaders here in Texas, from Mexico, Nuevo León, Mexico, El Grupo de 10, embark in minimizing the economic impact of suboptimal health under COVID-19. They retain a U.S. global management consulting company. They engage with healthcare systems in Mexico, NGOs, and government, and they're engaging with states in Texas. So Coahuila, Nuevo León, y Tamaulipas are embarked in this agreement, including transportation, reactivation of regional economies, in close coordination with healthcare systems. I would like to see this as an opportunity for us to consider how can we expand and take some of the opportunities under COVID. Another example that we just heard in our last meeting is the harmonization of public and private health sectors in California, a clinic research solution in which one hospital in San Diego side partnered with two hospitals in Mexico, and they created a critical healthcare program in which it was telemedicine-based, but also in-person activities. And this approach is serving for academic, community healthcare programs, and building collaboration across the border for COVID-19, yes, but it's expanding in a very unique way this global health economy. This is a pilot in a way, but we have the opportunity to look beyond that and see many of the workers that lead actually and the Mexican side work in this side and the health coverage. So there's a lot to peel in that. So how are we going to establish a post-COVID-19 and the next phase for the U.S. Section Border Health Commission? And I would like to summarize by three words: resources, priorities, and actions. We are doing a needs analysis assessment among the members to establish our own voice. And for that, we need a conversation about resources. For example, we learned that for the fiscal year 2019, over $2 billion were awarded for the U.S. border counties from Health and Human Services and the Office of Secretary. And about close to $287 million were invested in the Texas, states and the counties. Now, going back to our mission and goals for the commission is to review what is the investment and gather that powerful voice to take the pulse to diagnose the level of improvement on the health of our underserved and vulnerable communities, to maintain the well-being, but to see how we are connecting this skilled professionals, how is telemedicine, how is all these tools that have been, on the wraps and now are developing, and what type of investment and what are the recommendations. With those clear priorities, we can take actions. We can say this is what we need to bring to the table, and what other audiences and stakeholders need to be united so we have a collective impact into policy and ultimately for empowering the public systems to work together with industry sectors, with government, NGOs, and all the efforts that all of you are doing to improve the productivity, including all the financial outcomes and their adverse effects. Thank you so much for this opportunity.
Thank you, Dr. Vela Acosta. Your insights are very important, and we all agree that living in these unique times has magnified the many issues that are going on our border, and we appreciate the leadership of the Border Health Commission as hopefully we can come to the to increasing our access of care and improving the health care of both our brothers and sisters across the border and here in Texas. Finally, I'd like to introduce Dr. Victor Gonzalez, our final speaker, who will summarize our Zoom Along the Border series from earlier this summer. Victor, welcome.
Thank you for giving me the floor. I'd like to first start by telling you that we started with a Tele-Town very similar to this at the beginning of the summer. This was followed by 5 Zoom sessions that were sponsored by the local county medical societies along the border, including El Paso, Maverick County, Hidalgo, Stars, Zapata, Laredo, and Cameron-Willacy. The sessions were similar, about an hour. All were well attended, and many of the topics discussed in this Tele-Town session were first put forward at these meetings. The sessions were very important in not only educating our medical community to the challenges facing our unique communities along the border, but also the impact that the decisions up in Austin have had to our citizens. I think COVID-19 unmasked the deleterious effect that a decade of cuts in Medicaid have had and the erosion that it's created into our healthcare infrastructure. Although the infection rate was similar in our communities to the rest of the state, the mortality rate was 3 times greater. I think that we all agreed that that was multifactorial, but these cuts, along with the inability of our community to access care because of some of the Medicare managed care organization restrictions, were no doubt involved in these negative impacts on our local communities. The sessions were all represented by local legislative leadership. This clearly demonstrates that the members of our medical societies along the border have close ties to their leadership. And I think this was very important. In every one of the sessions, the leadership from the local communities was present, interested, and interactive. Our ability to have the local legislators present when we educate ourselves about the challenges we are facing is a plus. Aside from having a sympathetic leader, we also have one who's armed with the information necessary to present strong arguments when they lobby for the needs of our communities. And I think for the first time, we were able to present actual real-time numbers in terms of the challenges that COVID was presenting to our communities. And I can tell you that both privately and publicly, the leadership were very impressed and were very obviously concerned with what was happening. I encourage everyone to continue to nurture these relationships with their legislatures, because this coming session will undoubtedly have many challenges, and they will be pulled in 1,000 different directions. And I think they will need our continued support to make sure that we continue to lobby for the needs of our communities. We can no longer allow our infrastructure, our healthcare infrastructure, to continue to be eroded. We need action. We need to make those decisions now, and we need to make sure we inform the rest of the leadership up in Austin of the negative impact that we've had. I want to thank all the staff, volunteers, the CMS members for a successful program. Luis, thank you.
Thank you very much, Victor, for doing such a wonderful job to explain what we've done in the 5 Zoom meetings. And certainly it emphasizes the importance of fostering relationships with our legislators. And now is the time between now and January that we as physicians get to meet, get to know better, and ask our local elected leaders how we can help them, how we can educate them, and how we can then help our communities and make sure that the voice of the Border Health Caucus is heard. Now I'd like to have the final poll question of the night, and that is, which step will you take as a result of participating in this Tele-Town Hall event? Press 1 if you will apply the new health knowledge or practices in the response to COVID-19. Press 2 if you will use information learned to modify any business element in your practice. Press 3 if you will implement telemedicine in your practice. Press 4 if you will do more than one of the above, or 5 if you will do none of the above. Once again, which step will you take as a result of participating in this Tele-Town Hall event? 1, if you will apply new health knowledge or practices in the response to COVID-19. Press 2 if you'll use information learned to modify any business element in your practice. Press 3 if you will implement telemedicine in your practice. And 4 if you will do more than one of the above, or 5 if you'll do none of the above. So we've had some incredible speakers, and we're nearing the end of our program. So on behalf of TMA's Border Health Caucus, I thank everyone for participating in tonight's Tele-Town Hall event. We hope you found the information helpful. If you're not able to ask a question of our panelists, and I apologize for not having enough time tonight, please email at any time TMA at knowledge@texmed.org, knowledge@texmed.org, and TMA staff will reply in the coming days. Dr. Villarreal, I'll turn it back to you to close tonight's TMA Border Health Caucus COVID-19 Tele-Town Hall meeting. Thank you, everybody.
Thank you, Luis. We want to thank everyone who joined us this evening. We hope this TMA and Border Health Caucus service has been beneficial to you in some way. Our goal is to help you respond to this serious public health threat and to empower you to keep your medical practice viable now and in the future. I want to give special thanks to our speakers this evening, State Representative Cesar Blanco, our host, TMA President Dr. Diana Fite, Dr. Luis Benavides, Dr. Martha Vela Acosta, Dr. Victor Gonzalez. I also want to thank my co-moderator for the event, TMA's Border Health Caucus Chair, Dr. Luis Benavides, Urrea. Physicians who remained on the call for at least 53 minutes will automatically receive CME credit. You do not need to do anything to receive that credit. Again, we have your number and a log of how long everyone stayed on the call. So if you listen for at least 53 minutes, you will receive the CME credit. For more information about this evolving situation, please visit TMA's COVID-19 webpage at texmed.org/coronavirus. Once again, I am Dr. Linda Villarreal, your TMA President-elect. Thank you again for joining TMA's Tele-Town Hall on healthcare issues in the border region. Good night.